Here's Jade, and we're doing some distal needle acupuncture to open up the right inguinal SI joint, piriformis, basically all of these muscles that are related to hip flexion, as well as medial and external rotation of the hip. So we're going to start with joint ranges of motion comparing the right leg with the left leg. So Jade, I'm going to get you to do the right hip flexion first. Okay. And now show me your left hip flexion. So we can see there's definitely a lot more mobility on the left side versus the right. So there's about 20% right side deficiency as far as mobility is concerned. So now we're going to do the external rotation for the right. Okay. And now do the medial rotation. Okay. Alright, so we can see where we're at there. And now alternate with your left leg. We'll start with the external rotation. So bring the leg as far as you can down. Okay, there we go. So that's a lot deeper on the left side. And now the medial rotation. Yes, and a lot deeper there. So basically we're going to be doing openers for all of these. So I'm going to be working with some distal needling acupuncture here. And when you're going through those, what were the pain out of 10? So if you were to say hip flexion, pain out of 10, external rotation out of 10, medial rotation out of 10, what would you say pain scale?
It's really tight and tense. I don't know. It was painful before. It was painful during the first session. Now the pain feels like it's subsided, but still don't have the mobility as much.
Okay, so we saw that interference with the mobility. This is the second acupuncture session. The first session was 2 days ago. Okay, so basically we're going to focus on working with mobility again here. So we're going to have an active range of motion during this session of acupuncture. Let's go through the right hip flexion again. So are you noticing a change now with the mobility?
Yeah, I feel like I can go a bit deeper.
Okay. Test out now comparing right to left. So left hip flexion. Okay, now hug both knees in at the same time. How's that? So when you do that.
Yeah.
Equal?
Mm-hmm.
Equal. Okay, so we got the equal mobility there. Now I'll get you to do the external rotation here. That's looking a lot deeper. How does that feel?
It feels a lot more open.
Okay, so we got some nice openers here for the piriformis. So if you take your right ankle, put it over your left thigh, and then relax your right knee down. That's a good piriformis stretch in here now. Okay, so how does the tension feel when you do that now?
It feels a little tight up here, but...
At the top?
Yeah.
Now see if you notice a change pushing on the inguinal again with your right hand. See if that's changed there for you.
Yeah, I think it has.
Excellent. Okay, and
yeah.
How about the medial rotation? So there we go.
That's a lot more deeper.
That's deeper too. Take a look at the mobility here now. So let's do both knees at the same time. So bringing them both up. Okay, that's definitely equal. And now let's compare, contrast the external rotation. So right external rotation. Okay, and now alternate with your left. Okay, and now let's go right into medial rotation. Yeah, sure, we'll start there. Okay, and now show me your right. Nice, there we go. We got a nice opener there. Alright, so there we go. Doing some nice distal needle acupuncture to open up the piriformis, open up the inguinal, enhancing medial external rotation, hip flexion. Thanks very much, Jade. Awesome. So I'm going to encourage people to come if you have any issues with SI joint pain, hip flexion, mobility, interference. Come and see Thomas at Guiding Needle Acupuncture. Thank you.